Hello everyone, Dr. David Siffrey here, Disc Centers of America, Sarasota. So I just wanted to take a minute and do a little post on a patient here. This is kind of a special patient here because he made the trip all the way from New York to continue his care here at Disc Centers of America.
Sarasota.
So Jeff, tell us what's happened. How did you end up here? First of all, how did you end up in the New York clinic? What happened?
Years ago, I first saw you with issues with my back and my shoulder, and you were able to save me from the knife.
That's right, remember that shoulder?
Absolutely.
That was 20 years ago on that shoulder.
Absolutely. And then now, started with sciatica and lower back pain, and it just got worse. And surprisingly enough, it's getting better now that I've seen
So we finally went out and had an MRI done probably about a month ago, right? So we're about a month. Herniated disc in the back. He came in to the Syracuse clinic. He was kind of crawling when he got here. So we put a treatment in. He did about a week's worth of care last week and doing much better. Even with the drive down here to Florida, he's doing pretty well. So we're going to continue with care here. I gave him the option of waiting for me to come back in New York. He was feeling so good he didn't want to wait, so he wanted to come all the way down to Florida here to continue. So here we are.
Couldn't wait to be here.
Monday, we're going to spend a week going through a little bit more healing. Goal is to keep him out of surgery. If you want to find out how we can help you also, go to the website, sarasotadisccenter.com. It's a free consultation, so give us a call, 315-345-7390, or the Sarasota office is 941-358-2224. Give us a call and find out how we can help you, just like we're helping Jeff here keep out of the surgical suite. No pain, no drugs, no injections, and no surgery. So give us a call. The only thing you have to lose is the pain.
Worth the call, well worth the trip.
Let's watch. Let's put the table down and let's watch Jeff as he's going through some of this, starting his treatment here.
So really, the drive wasn't too bad for you? I mean, it felt pretty good coming down?
Yeah.
Dr. Siffrey, talk a little bit about what Jeff is going through here.
So right now we're going to put him on the table. The whole idea is to create negative pressure inside the spinal cord. The goal is to create, instead of cutting off that disc that's herniated and pressing on the nerve root, the goal is to try to create a negative pressure inside the disc, start drawing that nutrition back in so that he doesn't end up in the surgical suite. 9 out of 10 that qualify for care are healing without the surgery. Jeff's doing better already. He's only 5 sessions in here, but already I can, based on what we're seeing and the changes that are taking place, I don't see him in the surgical suite at this point. But this is what this whole process is designed to do.
And the idea here is to rehydrate those discs, right?
Rehydrate the disc, start drawing nutrition back into the spinal cord,
fluid
back into the disc, water, oxygen, nutrition starts coming back in. And with that happening, we can eliminate the surgical repair. Because without that pump working, without this nutrition coming in here, the only thing left to do would be to cut out that disc, and we don't really want that to happen. So, right, Jeff?
Absolutely. Second time that you've saved me from the knife.
That's it.
And what are you doing with Jeff now? Can you?
So we're just going to add in the harnesses. The harnesses create the stationary part of the movement, so just the spine is creating negative pressure inside the spinal cord. So we're just going to set them up with the harnesses to do that. Legs will come up for me, Jeff. Good, we're going to drop down.
Can you talk a little bit about?
Set up a little lower harness, and you set up a little top harness, and that allows for the vacuum to be created inside the spinal cord here.
3 weeks ago, I couldn't even lift my legs enough to get them over that bump.
And what's the difference you're feeling, Jeff, between when you first started? How did you walk into Dr. Siffrey's office? Were you able to walk in? Some people crawl in, some people are leaning over.
I was barely walking. If I could have been on all fours, I would have.
Okay.
I couldn't get out of bed properly. I was a mess. And after only 2 sessions, I was able to literally get out of bed on 2 legs rather than all 4. I'm sleeping better, sleeping through the night. This has been fantastic.
Good changes. A lot of things happening.
Okay. I know some people talk about, having asked Dr. Siffer the difference between decompression and
Traction.
Can you explain a little bit about that, Dr.
So
Siffer?
the difference between traction and decompression, traction is designed to stretch the body and create a pull in the muscles, where decompression is designed to create a negative pressure inside the spinal cord. So two different events. They kind of feel the same because he's getting a little bit of a stretch on the body as we create the negative pressure, but there's two different events, two different procedures that are taking place. Decompression, negative pressure, creates the negative pressure inside the spinal cord to create healing. Traction is more of a muscular thing. We're trying to stretch out muscles.
So is traction is the same thing as decompression, and
Two
how?
different events, two different pieces of healing. So the traction is going to create more, is more for the muscles. This is more for the spinal cord.
And the traction's not going to create that negative pressure or
Correct.
rehydrate the discs.
Traction is two different events.
Okay. Anything to say before you fall asleep, Jeff?
All I can tell you is that this man will save yourself from the knife. Fantastic care. I've tried everything from TENS units to inversion tables, and all that was a temporary relief of pain. I am now experiencing a complete relief of pain. It's well worth the time. If you've got any type of back pain, this is the place to be.
And how long will he be on the table, Dr. Sifra?
He's going to be on this table for about a half hour, creating the negative pressure. And then when we're done with this, we're going to add lasers into your care today. That's something we haven't done yet, but we're going to add lasers.
Speaking of that, do you add other modalities to a patient's treatment?
Yep, so we're going to be adding lasers. We can do electrical muscle stimulation. There's nutritional components that we add in. There's a lot of ancillary pieces that you can add in on top of the decompression. So today we'll start with some laser to start some soft tissue healing, and then detoxifying the cells. So that helps stimulate a lot of healing very quickly. So that's something we'll add in today.
So laser, nutrition,
Electrical muscle stimulation. I mean, there's a lot of pieces that I add in as part of our trademark procedures there. So it just really depends on what we need to do. Unique procedures, patient by patient.
Okay. Do you want to sign off one more time with your contact information?
Give us a call, 941-358-2224, or go to the website, sarasotadisccenter.com. A lot of good information about who we are, what we do. You'll see research, procedures, testimonials. So some good insight there on how we're keeping patients out of the surgical suite. So give us a call, free consultation. The only thing you have to lose is the pain. So give us
And
a
DISC is DISC.
DISC.
SarasotadiscCenter.com. All right. Thank you.